So, dear students, so today our topic is respiratory system. So, these systems play an important role in the respirations. That is to supply the oxygen to the body and as well as the removal of the carbon dioxide from the body. So, it is one of the main system. So, that was helpful for certain nutrition also in the form of the oxygens. Okay, so that oxygen is required for the various metabolic functions. So that's why, so the metabolic functions or process or reaction, so that was also depending upon the conditions of the respiratory systems. So now we can go for regarding the learning outcomes. So after completions of this video tutorial, you should be able to identify the various parts of the respiratory systems. So as well as, so you are able to describe the anatomy and physiology of respiratory organs. So these are the learning outcomes. So now we can go for the introductions. So regarding the respiration, so respiration is the process or phenomena. So where the lungs can involved in the our respiratory systems was involved in the exchange of the respiratory gases between environment and alveoli of the lungs. From the environment, it can take the oxygen and give the carbon dioxide, and as well as in the same time, so that alveoli is also involved in the exchange of the respiratory gases that of with the blood. So blood loses the carbon dioxide and gain the oxygen. So that entire process was known as the respirations. So respirations, once again, so there are mainly two types: exhalation and inhalations. So exhalations, that is the to give the carbon dioxide to the external environment, and inhalation to take the oxygen along with the other respiratory gases to inside the body, inside the lungs. So that was known as the inhalation. So that's why the respiration is the phenomena or process or mechanism in which, so our lungs, it can take the oxygen and give the carbon dioxide to the environment, as well as it can exchange the respiratory gases, so that off with the blood. So that process was known as the respiration. So regarding the normal respiration rate, so newborn baby, so that will be having the 30 to 60 per minute. Then early childhood, that is 20 to 40 per minute, and late childhood 15 to 18 per minute, and adult having 12 to 16 per minute. Okay, so these are the normal respiration rate. So here the newborn, so they will be having the 30 to 60 respirations, that is inspiration as well as expirations. So that was 30 to 60 per minute. So the rate of respiration is more in newborn as compared to the adult. Okay, so universally adult having an and average, that is the 18 respiration rate per minute, but in newborn or childhood, so that will be having the nearly 30 to 60 or 20 to 40 respirations per minute. So now my question for you is, so why that is the changes? So newborn, so they will be having the more respiration rate as compared to the adult. So anyone can able to answer? So anyone? So why newborn baby or child in the early childhood, so having the more respiration rate as compared to the adult? So adult having only an and average 18 per minutes, but newborn that will be having the 30 to 60. It means an and average, that is the 45. Hmm? Less? हाँ, whatever you know you tell. There is no worry. हाँ, आंसर देने के लिए डरो मत. No one, मैं पहले आपको बोलता हूँ, no one is a perfect. No one is a perfect. Even me also. Hmm. They already. Okay, okay. So for you, my suggestion is the oxygen cannot be stored in our body. Okay, always it can exchange it. Cells blood, blood cells and lungs, blood lungs and lungs environment, environmental lungs. Storing capacity nahi hai. Okay, then any others? Huh. Simple answer is there. Already I told. Oxygen is also one type of nutrition. Okay, it is not a nutrition, but it is a components of the nutrition. So that was required for the various metabolic process. Okay, oxygen, it is the factor. It is required for the various metabolic process or reactions. And metabolic process or reaction is required for the development and growth of the body. Okay, those are required for the development and growth. As the metabolism increases, the synthesis of protein, synthesis of certain energy, synthesis of certain molecule, hormones, enzyme, so that was increases. And each and every biochemical reactions, okay, process, so they are required the oxygen as a molecule, okay, as a reaction regulator. Okay, and those biological process or biochemical process, those are required for the development and growth of the body, development and growth of our organ, our systems, our body. So that was depending upon the protein synthesis, and protein synthesis is the biochemical reactions or biological process, and that process required the oxygen. Okay, in newborn, the rate of growth is more as compared to the adult. So when we become the adult, so there is no growth is present, slight growth is present, but repairing process present. But in newborn, day by day, the height of the that newborn was increases, the organ was developed. Okay, in the womb, so there is no enzymes are involved, then they are no not present. But after the birth, so the enzymes are synthesized in the newborn baby. So that's why they require the more biochemical reaction, and more biochemical reaction, so they require the more oxygen. So that's why, so the newborn, so they will be having the more respiration rate as compared to us, depending upon only the growth rate or metabolic process in newborn will be more as compared to the adult. So now we can go for the functions. So respiratory systems, it was play an important role in the exchange of the respiratory gases like oxygen, carbon dioxide and nitrogen. It is also considered as the respiratory gases. Okay, so respiratory system, so it was mainly involved in the exchange of the respiratory gases from environment to the lungs, and lungs to the blood. Okay, and blood to the our metabolic cells. So there is different stage the respiration is occurs. Okay, so that is one of the major functions of the respiratory system. So next one, that is the respiratory system is helpful for the pH maintenance. That is the pH of the blood, that is also depending upon the respiratory system. So respiratory systems, it is mainly consist of the carbonic anhydrase enzyme that was required for the formations of sodium bicarbonate, and sodium bicarbonate play an important role in the to maintain the pH of the blood. So that's why, so respiratory systems is also involved in the to maintain the pH or pH of our plasma or blood. Okay, so next one, that is the temperature regulation. So respiratory system is also involved in the temperature regulations along with the skin. Okay, skin, so with the help of the sweating, it was involved in the loss of the excess temperature or heat in the body by direction given by the thermostat. So that thermostat was present in the hypothalamus. So when our body temperature increases, so that was detected by the thermostat. So that was placed or present in the hypothalamus. It is one type of the biological thermometers. It can detect the body temperatures. Okay, our temperature in the blood. Then on that time hypothalamus, it can suggest the ANS. Then ANS, it was involved in the sweating. Okay, it can insist give signal to the our skin, then skin can undergo the sweating. So due to sweating, the loss of heat is occurs. So that's why when you are taken the medicine any for to decrease the fever, so when you have got the sweating means then only we can feel the free from the all fatigue and fever. because that sweating process by taking of the medication that was helpful for the loss of the body temperature or excess heat. Same time, so the lungs during the exhalation, some amount of heat is also lost. So already you know. So during when temperature increases in your body, so when your exhalations, okay, so on that time some heat is exhaled to the environment. So already you can feel. Okay, so you can recall your history or memory. So when you having the fever in the last decades, okay, so where when your respiration, your warm air can be exhaled. So that was also helpful for to remove of the excess of the heat, and as the respiration increases, that was helpful for the movement of the blood with the oxygenated blood. So that oxygenated blood is also helpful for the removal of the waste material. Those are responsible for the to cause of the increased body temperature. So that's why the respiratory systems is also involved in the regulations of the body temperature along with the skin under the directions of the hypothalamus. Okay, next one. It is also helpful for to maintain the venous returns. Okay, so respiratory system, so it is also helpful for to venous return to the our heart for oxygenation process. Okay, so that is one of the another main functions of the respiratory systems. So next one is the, it is also involved in the defense against the microbes, certain leukotrienes, cytokines. So those are also synthesized in the lungs. So whatever we can inhale the air, if they are containing the microbes means, so that respiratory system, it is having the capability to kill the microorganisms. So that's why the respiratory systems is also involved in the to show the defense against the microbes. So next one, so it is acts as the humidifier to the, our body or inspired air. It having certain secretion. So that secretion, if you when you are taken the warm air, so that it acts as the humidifier, and that is helpful for to keep the body cool. Okay, so when you're taking a deep, when you're having some increased heat in your body, okay, on that time you can take the proper respirations. You go to sit in the cool places or below the tree where having the full of oxygen, so where you can take the deep respiration as well as the deep expressions. Okay, the inhalation as well as the exhalation, so that was helpful for to keep to cool your body. So that phenomena was known as a humidifier. So this is the one of the another important functions of the respiratory system. So that's why the respiratory systems play an important role in the exchange of the respiratory gases as well as to maintain the pH of our body fluid or plasma or blood, and also it is involved in the regulations of body temperature, maintenance of the venous returns, and defense against the microbes, and as well as it acts as it is helpful for the humidifier, and also it was involved in the oxygenation process, that is the filtrations of the blood regarding the to take the carbon dioxide or to remove the carbon dioxide from the blood, and it can give the oxygen to the blood. So that oxygen blood reaches to the heart, from the heart it can reaches to the systemic circulation then throughout the body. So like that, the respiratory system is also helpful for to supply the continuously oxygen to the our body. So next ones, so we can go for the parts of the respiratory system. So the respiratory systems mainly divided into two parts. There is upper respiratory systems and the lower respiratory system. So upper respiratory systems, it mainly consists of the nose. So nose is the first organ or first part of the respiratory system. It is present on the skull or on the face. It is externally, it can expose to the environments. Okay, so that is the first organ. Okay, so that is the first component. So that was involved in the respirations. And second, that is the pharynx. So it is also known as the throat. So after the nose, so that part was known as the pharynx. You can easily you can see in the this image or this figure. So this is the first is the nasal cavity. So after that there is the pharynx. Okay, so then the lower part respiratory organs, so those are, that is the first of the larynx. It is also known as the voice box. So that larynx was helpful for the passage of the air, so that was inhaled by the nose or pharynx. Then there is a trachea, that is a wind pipe. Okay, so it is only, it can acts as a channel or passage for flow of the that is the respiratory gases or air into the lungs. The next one is the bronchi. So these are also branches of the trachea. So they are helpful for the passage of the respiratory gases. Then bronchioles. So these are the further branches of the bronchi. So they function similarly. So they are helpful for the transport of the respiratory gases. Then alveoli are air sacs. So these are the small pouches. So they are attached with the end of the each bronchioles. Okay, so we are approximately having the more than 700 millions of the alveoli or air sacs. Okay, so this is the pouch or air pouch. So they are when we are inspire, so then that they can hold the pure that is the air or oxygen containing air. So then that was helpful for the exchange of the oxygen, that of the blood. So the air sacs are alveoli. So this is the place so where the respiratory gases can be stored and exchanged with the our blood. They can give the oxygen to the blood and take the carbon dioxide according to the partial pressure of the oxygen and carbon dioxide in the alveoli and as well as in the blood. So next, that is a part of the respiratory system is a, that is the lungs. Okay, lungs is the main hollow organs or main part of the respiratory system. It was helpful for the exchange of the respiratory gases. So next one we can go for one by one. That is the first we can learn regarding the nose anatomy. So once again the nose, it was divided into two part, that is external nose and as well as the internal nose. Okay, the upper part, so that was you are located in the face of the other's nose. So that located to the other person's, so that nose is known as the external nose. Okay, so just below inside the skull, then that was known as the internal nose. So like that, the nose is mainly divided into two parts, external nose and internal nose. So external nose is made a cavity. Okay, external is nothing but on the cavity. So that cavity was made so by a help of frontal bone, nasal bone, maxillae and septal cartilage. So these are the bones, their junction. So they are responsible for the formations of the external nose. So regarding the frontal bone, nasal bone, maxilla, then as well as the septal cartilage. Then regarding the internal nose, so it is the framework formed by a ethmoid bone, maxilla bone and nasal concave bone. So these are the different bones. So they are responsible for to formations of the framework for the external nose as well as the internal nose. So next one, so regarding the functions of the nose. So nose, it was play an important role in the warming the inspired air. So during the cold, so that air is too cold. So that is also create the problem in the exchange with the blood. But that cold air was warm by a nose. Okay, so in the winter, so the nose warm the air. Okay, but in summer, so the air is more warm. Then the same nose, with the help of the nasal secretions or nose secretion, it can moisten the that inspired air. So that's why the nose, according to the seasons of the environment, it can warm the incoming air as well as it can moistening the incoming air. Okay, so as well as so the nose, it is also involved in the filtering the incoming air. So in the nose, certain nares are present or nasal nares are present. That is nothing but they are the hair. Okay, so the hair is present in the nose. So they are helpful for to filter the incoming air to avoid the entry of the dust in the nasal cavity. That is the work of the internal nares or the hair. So those are present in the nose. So that's why the nose, it was play an important role warming, moistening and filtering of the incoming air. So next functions, so it is also play an important role in the detecting of the olfactory stimuli. Nothing but olfaction. Olfaction is nothing but smell. So the nose, it's play an important role in the detections of the stimuli along with the olfactory nerve. So olfactory nerve, so their sensory end, so they are present in the nose. So whenever any taken the smell, okay, so that was detected by the olfactory nerve. So those are present or located in the nose. So that's why, so nose is also play an important role in detecting the olfactory stimuli. That was known as the olfactions. So last one, so the nose is also helpful for to modify the speech vibrations. It give the rhythm to our speech. Okay, actually speech, so they are produced from the larynx or voice box. Certain rhythm is there in our speech when you are singing, when you are talking. So when you're talking with the parents, so sound is different. When you're talking with our classmate, then the sound is different. When you're talking with our close one, then also the sound is different. So when you're angry, the sound is different. When you're cold or happy, so the sound is different. That resonance to the sound that was created by the nose. So that's why the nose is also having the capability to modify the speech vibration. So these are the important functions of the nose. So next one we can go for the pharynx anatomy. There is the pharynx. It is the funnel shaped tube. Okay, it is the just after the nose. Okay, that was known as pharynx. The pharynx is also known as a throat. The size of the pharynx is 13 centimeter or 5-inch long. So regarding the anatomical region, so anatomically the pharynx is mainly divided into three parts. The first part just finishing up the nose, so that part was known as the nasopharynx. Then after nasopharynx, so that part was known as the oropharynx. Then after oropharynx, that part was known as the laryngopharynx. Okay, so like that. So anatomically, the pharynx, it was also known as a throat. It was mainly divided into three parts. That is the nasopharynx, oropharynx, and as well as the laryngopharynx. The regarding the functions, so pharynx, it can perform the digestive function as well as respiratory functions. It means the pharynx is also having the opening for the oral cavities. Okay, so that's why it was helpful for the propulsion of the food from oral cavity to esophagus, and as well as in the respiratory system, it was helpful for the movement of the air or transport the air from nose to the larynx. So that's why the pharynx, it was perform the both digestive as well as the respiratory functions. So next one, it is also give the protection to the against the microbes, because in the pharynx we having the tonsils, and tonsils are the virus for the T lymphocytes. Okay, so that's why, so this pharynx, due to presence of tonsils, it gives the protection to the our body are having the capability to kill the microbes. So next one, it helps in hearing. That the artery is that is the eustachian tube, it is also having an opening in the pharynx. Okay, the eustachian tube, there are also in the agit tube, so that was present in the internal ear. So that tube is also having one opening. Okay, so in the pharynx, in the oral cavity. So that's why the pharynx is also involved in the hearing. So next one we can go for the regarding the larynx. So the larynx is also known as the voice box. It is the first organ from lower respiratory system. It was also known as larynx, that is the voice box. It is helpful for the productions of the speech or voice, and also it was play an important role in the passage of the respiratory gases between pharynx and the trachea. So exact locations of the larynx is, it is the present between the larynx, that is the throat, and the trachea, that is the windpipe. Larynx, it is also known as the voice box. It connects the laryngopharynx with the trachea. The position, it is exactly entered to the neck, that is the between C4 to C6 cervical vertebra. Okay, exactly the locations of the larynx is between C4 to C6 cervical vertebra. So it is the made up of thyroid cartilage, then cricoid cartilage, arytenoid cartilage, then corniculate cartilage, then as well as the cuneiform cartilage. So these are the then it is also consist of the epiglottis. So these are various cartilage. So they are helpful for to make the voice box or larynx. So they are also involved in the to productions of the voice and also involved in the passage of the respiratory gas between the larynx and as well as the between the pharynx and as well as the in the trachea. So regarding the functions, so it play an important in the productions of sound and as well as the passage of the air between pharynx and as well as the trachea. Then also it is involved in the filter, warm and humidify the inspired air. So next one is the trachea. So trachea is also known as the wind pipe. So it is just one pipe between the larynx and bronchia. So this is helpful for the movement of the air or passage of the air or transport of air from larynx to the bronchi. So size, so it is consist of 12 that is 10 to 12 centimeter length. So location just enter to the esophagus. So it is the front of the or it is entered to the esophagus. So next, so it is divided into at the end it is divided into right and left primary bronchi and it is consist of that is a 16 to 20 C-shaped incomplete rings. So these rings they are made up of the certain type of the cartilage. So they that is the trachea it consists of about 16 to 20 C-shaped incomplete rings. So regarding the functions, so it is helpful for the passage of the air or respiratory gases. So next one regarding the bronchi. So this trachea, so they are divided into two part, that is the left as well as the right. So those are known as the bronchi. So there is a structurally the bronchi, it is the branch of the trachea. So it is get divided into right bronchia as well as the left bronchia. So left bronchia inverted into the left lungs and right bronchia is inverted into the right lungs. So regarding locations, it is just outside the medial depression. So exactly centers of the our body or chest is known as the medial region. So in either side if we having certain depression, so that depression that is the exact locations of the bronchi. So regarding the size, so the right bronchus is wider and shorter and straight than the left. So next one is the lungs. So the lungs are the spongy air-filled organs. Okay, so these are located in the either side of the thorax, that is the chest, as well as the it is the organ for the respiration. So these are the two lungs, so they are present in the human body. So this is the main organ, so where the exchange of the respiratory gases that was taken place. So actually regarding the location, the lungs can occupy the entire thoracic cavity except the most central area, that is the mediastins. Okay, the central area of the our chest, so where they cannot be occupied by the blood, but remaining parts of the thoracic cavity, so that was the locations of the lungs. Because so in the mediastinum, which is a house for the heart and great blood vessels, bronchi, esophagus and other organs. So after the mediastinum, that is the exit are covered by the or presents the locations of the our lungs. So regarding lung structure, so lungs are roughly cone shaped with the having an apex, base, three surfaces, three borders. The left lung is slightly smaller than the right. Okay, because due to presence of the heart in the left side, so the left lung is smaller as compared to the right lungs. So each lung they are mainly consist of the apex. So apex is the blunt superior end of the lung. Okay, so this is the apex. It is superior end of the lung. It protects it projects the upward above the level of the first ribs into the floor of the neck. Okay, so next is the base, the inferior surface of lungs, which is sits on the diaphragm. So this is the base, and these are the apex. The upper parts of the lung, that was known as the apex, and bottom of the lungs, that was known as the base. The base is present just above the diaphragms and affects, so they are attached with the our clavicle bone. So regarding surfaces, the lungs having three surfaces. Okay, according to the area where the thorax that can face, so then they are divided into three parts. So they are the coastal surfaces. So these the, okay, so these part, so these are known as the coastal surfaces. Then second one is the mediastinal surfaces, that is exactly the center part, that was known as the that is a mediastinal surfaces. Then so this lower part or lower surfaces, it is known as the diaphragmatic surfaces. So like that, so according to the lungs which can expose to the area of the thorax, so then they are mainly divided into three surfaces, that is the coastal outermost, then mediastinal innermost, and the below, that is towards the diaphragm, that was known as the diaphragmatic surfaces. So regarding the borders, so the lungs, so they will be having the three borders, that is the interior, inferior, as well as the posterior borders. So next also regarding the lungs, so the right lungs, it is having the mainly three loops, and the left lung, so it is having only two loops. So here the horizontal fissures, okay, so it is was helpful for to make the three loops in a right lungs, but in the left lungs, the oblique fissure. Okay, so the oblique fissure, so this is one type of the cartilages or tissues. So they can divide the left lungs into a two part, that is the superior lobe and as well as the inferior lobes. So that's why, so the lungs, that is the right lungs having the three lobes, that is the superior, that is the mid lobe, and as well as the inferior lobes. So those are divided as a lobe by a horizontal fissures. But the left lungs, it is having only categorized into only two lobes, that is the superior lobe and as well as the inferior lobe. So that lobes was formed or divided by a oblique fissure. So like that, so the lungs, it mainly consists of the five lobes are categorized into a five lobes. So right lungs having three lobes, and the left lungs, it will be having the two lobes. So next one, so regarding the further features of the lungs, so each lungs, they are surrounded by a pair of pleural membranes, that is the uh, partial, that is the parietal pleural or parietal membrane, and as well as the visceral membranes. Okay, so the lungs, so they are separated by the two layer, that was first one is known as the innermost, is known as the, that is the parietal, so it is the outermost. Okay, then another one is the visceral, that is just above the lungs. So they are made the one membrane, so that membrane was known as the pleural membrane. So between the parietal membrane and visceral membrane, it having certain cavity, so that cavity was known as the pleural cavity. So this is the cavity, so that can formed by a two layer, that is the visceral layer and as well as parietal layer, between there having the gap, so that gap was known as the pleural cavity. So that pleural cavity, it can filled with the fluid, so that fluid is known as the pleural fluid. And pleural fluid, so they are play an important role in the inspiration as well as the expression. So what a pressure in the pleural fluid, that also reflect on the inspiration and as well as expression. So that fluid is also, it can protect the lungs, or it can avoid the lungs over stressing during the forceful inspiration. During the forceful inspiration, the lungs can be expand. There is a chance of the injury, but that cannot be happens due to presence of the pleural fluid. So that's why the pleural fluid or cavity, they give the mechanical support to the our lungs. And the bronchi, so they are divided into millions of a bronchioles and small branches. So those are known as the bronchioles. And the end of the bronchioles, one hollow air sacs is present. So that was known as the alveoli. So each end of the bronchial, one air sac or air pouch is present. So that was known as alveoli. And there is a 7,000, 700 millions of alveoli is present in the lungs. So this is the place so where the respiratory gas can be came from environment to the lungs, and from the blood they can exchange with the carbon dioxide. So this is the alveoli or air pouch. So they are the site are also known as the air sac. It is the site so where the respiratory gases can be exchanges from environment to the lungs or from lungs to the our blood. Okay, so that's why the air sacs, so they are play an important role in the exchange of the respiratory gases. So this is the anatomy regarding the lungs and physiology. So these lungs, they are mainly site for the respirations. Okay, it is helpful for the inspiration as well as expiration, oxygenation process, then as well as filtering the inspired air and removal of the waste material like a volatile. Okay, so lungs also involved in the excretions of the waste material from the body. Those are volatile substance, those are volatile drugs or fatty acids. So they are maximum excreted through a lung. So these are the important functions of the lungs. And also, so the lungs is involved in the exchange of the